I'm Kelly, one of the vascular access nurses here at UTMC, and I'd like to discuss with you central line care. It is our goal to make sure that we are following evidence-based practice and doing all that we can to prevent bloodstream infections to our patients. Bloodstream infections can cause great harm and increase the cost of care. I will start with peripheral IVs. Always cleanse your hands prior to any care of a peripheral IV. Per the Infusion Nurse Society, peripheral IVs are only changed when clinically indicated, which means when the patient complains of discomfort around the site and if it is red or edematous. For your IV tubing, it should be changed every Monday and Thursday, making sure that you are labeling and dating your primary and secondary tubing. If any of them are used intermittently, they must be changed every 24 hours per INS standards. I will now talk to you about central line care, which includes PICC lines. Only insert a PICC line or a central line when it is clinically indicated, and make sure that you assess the need daily and that proper documentation is done. For all PICC lines, they will be inserted by the PICC team. All other lines, which includes subclavians, IJs, and ports, will be inserted by the medical team, either on the floor, in IR, or OR. For the insertion of a central line, the patient must be covered in a full barrier drape. The inserter must wear a sterile mask, a cap, wear sterile gloves, and a sterile gown. All those else in the room helping must also wear a mask. Do not be afraid to stop the inserter if you see them break sterile technique. It is our job to prevent harm to our patients. The inserter must secure the catheter at least 1 inch from the insertion site so that proper placement of the biopatch may be done. Use the IJ dressing kit for changing all central lines and making sure that you grab the stat lock and skin prep. In the event that the patient has bleeding issues and there is gauze underneath the dressing, when the gauze is present, it must be changed every 2 days. Assess the central line site every 4 hours or every 1 to 2 when your patient is critically ill, sedated, or cognitively impaired. The dressing must be changed by the bedside nurse anytime it becomes soiled, loose, or wet. The PICC nurse will change all central line dressings on Wednesday. In the rare case that the dressing is not changed by the PICC team, it is the bedside nurse's responsibility to change the dressing on Wednesday, making sure that you are dating, initialing, and timing your dressing. I will now perform a PICC line dressing change. First, cleanse your hands. Making sure rubbing your hands together until completely dry and then putting on your clean gloves. I will now grab the IJ dressing kit, opening it up sterilely. Taking my gloves and setting them aside. And taking my mask and putting it on. Then taking your stat lock and skin prep and adding it to your tray. And assessing your PICC line site. Peeling off your dressing. Making sure that you're pulling away from the insertion site. And also carefully taking off your stat lock. Again, assessing your line, noticing any redness, warmth, or swelling around the insertion site. Also noting the external length of your line. Taking off your clean gloves. Performing hand hygiene again. And putting on your sterile gloves. I will now clean the site, making sure that you're activating your ChloraPrep. And scrubbing for 30 seconds around your insertion site. You can pick up a piece of paper from your kit to hold your PICC line, making sure you're scrubbing underneath and all around your insertion site. Allowing for your skin to properly dry. Once your skin is dry, next using the skin prep. Allowing that to properly dry, and then putting on your stat lock. Using a new piece of paper from your kit, lifting up your PICC line to place your stat lock. Now I will apply the bio patch, making sure that the blue is to the sky, simply splitting your bio patch and placing it down. No twisting or turning of the bio patch. Now I will place the dressing. Making sure that you are labeling and dating your dressing once you are finished. When a patient is admitted with a central line in place, assess the need for the continuation of the line, ensuring that proper documentation is done for the continued need. Also ensure that the proper placement is done for the line. In addition, the dressing should be changed, also the stat lock, all needleless connectors, and placing orange disinfectant swab caps. Orange disinfectant swab caps must be placed on all unused needleless connector sites on all central lines. Once they are removed from the line, they should be changed. If there is no need to remove the orange disinfectant swab cap, they can stay in place for 7 days. Central line insertion sites are not to be changed unless there are signs of infection or if there is a malfunction. As a reminder, I'd like to talk about the components of a central line, making sure that you're changing your IV tubing every Monday and Thursday and also labeling it and dating it. Any tubing used intermittently must be changed within 24 hours. Also, any tubing with blood products, blood, or any TPN, refer to the hospital policy on when to change the tubing. I will now perform a needleless connector change, making sure first that you're cleaning your hands, putting on clean gloves, and making sure that you're assessing your needleless connectors daily and also changing them with your IV tubing on Mondays and Thursdays, or sooner if visible blood is in the connector. Blood can be drawn through the needleless connector. Having your supplies gathered, first priming your IV connector, and setting it aside. With a brand new alcohol swab, scrubbing the connection site for 15 seconds. Then disconnecting your old IV connection site. Again, grabbing a brand new alcohol swab and scrubbing for 15 seconds. Then connecting your new needleless IV connector. When you flush your central line, making sure you're using the pulse pause method. And always remember that at each and every time you access your needleless connector or the line, that you scrub the hub for 15 seconds with a brand new alcohol swab. In an effort to decrease collapses for our patients, it is important that every patient with a central line is provided with a CHG bath daily and also properly documented. Some patients may note that it is uncomfortable or sticky. You can provide the educational sheet for the CHG bath to the patient. It is important that they know that this bath being done daily helps reduces the risk of bloodstream infections.
Thank you so much for taking the time to watch this educational video today. Remember, here at UTMC, it's all about teamwork.
And don't forget, if you have any further questions, not to hesitate to contact your infection prevention department or your vascular access team.
Woo!